10:22 Central African Time. The month of March is International Women's Month, and today we discuss an issue that affects many women across the world, and that is fibroids. Now, uterine fibroid embolization, otherwise known as UFE, is a minimally invasive procedure used to treat uterine fibroids. The procedure reduces symptoms such as heavy and prolonged menstrual bleeding, pelvic pain, and pressure by cutting off the blood supply to the fibroids, causing them to shrink. We are now speaking about treating fibroids using UFE, and we're having the conversation now with interventional radiologist Dr. Maja Wojno. Good morning. Thank you so much for joining us.
Good morning, Puleng, and thank you so much to Palesa who invited me during this month. And it is International Women's Health Month, so that's like really exciting to be here and to chat to you guys. So thank you for the invitation, and I'm really excited to be here.
Work.
Yes, so I went to one hospital, then another hospital, then had a quick coffee, then came here.
And you're going to work again?
Yes.
Yeah, my goodness.
It's fine.
Wow.
But I was so excited to see you, and thank you for having me. And sending hi to all your listeners.
Yeah.
I don't know which camera to.
That's your camera over there. That's my camera over there. Okay, and the doctor came dressed in uniform with Larry, so
so I actually put my brightest scrubs on for you guys.
Cute.
Thank you.
Just for radio?
Yeah.
Not for the hospital.
No, but I knew that there was a camera there, so I was like, I had to find my brightest scrubs, but also it's also to make my patients happy.
Also, you do wear them at the hospital as well.
I always change my colors just to make things interesting and exciting.
Honestly, I didn't know that there are many colors. I thought it was the blue and the green.
Yeah, no, there's all the colors of the rainbow, so like 90% of my cupboard is scrubs.
How? Okay, I learn something new every day. So, doctor, to start with the basics, what exactly are fibroids and how common are they amongst women?
So uterine fibroids are extremely common. I think we actually don't realize how common they are. What they essentially are, they're benign tumors which involve the womb. So the uterus, they're composed of smooth muscle cells and also fibrous connective tissue, and they are benign, which obviously means that they're non-cancerous, and they develop within the muscle of the uterus, sometimes on the outside, sometimes near the cavity of the womb. The prevalence is actually really high. Recent studies have actually shown that during the lifetime, a woman's lifetime, up to about 70 to 80% of women actually have fibroids, which means that, it's quite a large amount. But in saying so, only 50% of these patients actually need treatment, because often, they are there, but they don't really need sort of treatment. But to answer your question, they are extremely prevalent, and particularly in certain population groups. So in patients of African descent, they're actually a lot more common. They're a lot more aggressive. The symptoms occur a lot sooner. And they recur and they are treated a little bit more. It's a little bit more difficult to treat them. So the prevalence in this country is quite significant, and it's quite a significant burden, and a lot of patients, struggle. And what's sad is they struggle in silence because, they aren't aware that there are minimally invasive options to treat these conditions.
Sure.
And they actually are.
So you said the 50% that doesn't need treatment, they have, but they don't like.
Often fibroids are diagnosed during a general sort of checkup with a gynecologist. So, if they aren't causing problems, if they're small, if they, aren't affecting a patient's quality of life, they're often just monitored over time and don't necessarily need sort of treatments. As soon as they sort of become larger, or depending on their location, certain treatments are available to assist with that.
Yeah.
And the treatments sort of vary from medication to control the symptoms in terms of pain and, the cycle and the heavy bleeding, to sort of intrauterine devices like Mirenas, which also reduce bleeding significantly during the cycle. And then the procedure that I do, according to the sort of graph of invasiveness. And then there's the traditional procedures, which are the surgical options. So the myomectomy, which can either be an open procedure or via a laparoscope, which is through small little holes and cameras. And the last is obviously, and the most sort of definitive option, is a hysterectomy. And what is actually quite interesting, yesterday, because I do follow on my page a lot of these foundations and fibroid groups sort of internationally, and what was interesting was a patient which actually struck a chord with me. She was saying that traditionally all she knew, so her grandmother had fibroids and had a hysterectomy, her mother had fibroids and had a hysterectomy, her aunt had fibroids and had a hysterectomy, and then she was offered that. And it's 2026, and the fact that in her mind that was because everybody in her family, it was just a knee-jerk reaction that you have to take out your womb. She was quite surprised when she came across other minimally invasive options, because she was like, wow, I actually don't need to lose an organ. So I'm not saying that a hysterectomy is not indicated, and in many patients, if there's a suspicion of underlying cancer, or depending on size of fibroids or whatever it is, but I think the option of embolization and minimally invasive options should be given to the patient, so that they are aware of everything that is out there, so they could also are informed of their options.
And let's say some women haven't really gone and said they're checking out for it, but what are the symptoms that one can look out for?
So the biggest symptoms, so the most prevalent symptoms are heavy bleeding. So it's usually more than sort of 7 days a week, and then it also depends on the amount of sort of tampons and pads that you're using. So if you are, for instance, changing your tampon and it's completely soaked, or your sanitary towel every 2 hours, that suggests that your periods are extremely heavy. And also if there's clotting, that also suggests that they can be heavy. So heavy bleeding is one of the symptoms. The other one is pain. So not only period pains, but also pain during the sort of period. We also find patients who have irregular periods. They have spotting in between their cycles. When fibroids enlarge, and it's usually the fibroids on the surface of the womb, they can sort of push on surrounding structures. So some of our patients come with pressure on the bladder. They feel like they need to urinate. They get up during the night to go pee. They have a constant sort of need to pass urine, and then they can also cause things like constipation. And then other symptoms or sort of side effects can be related to fertility. So because of a fibroid's location, it may affect implantation. It can also grow during pregnancy because of the enlargement, the increased sort of hormones during the pregnancy, and can cause complications. So it can impact on sort of conception, but also the pregnancy process. So also numerous symptoms, and I think once these symptoms start affecting a patient's quality of life, then it may be important to just make sure that you've seen someone just to get a diagnosis, because I think what a lot of patients have come to us and said is they always thought it was normal because their mom had very heavy periods, and they often feel that it's just something that is it just happens to women. So they suffer in silence, and the fact that they think that it's normal, and they just put up with it because they just feel that it's something that's part of being a woman. So I think definitely if the symptoms are impacting your quality of life, or if you're needing to take time off work, or if you have debilitating pain, or if you're anemic, or if you needing to take extra clothes with you to work in case of accidents, or if you that you wake up in a pool of blood in the morning, which one of my patients actually said to me last week, then that's something that needs to be investigated.
Sure. And you treat fibroids using a procedure called Uterine Fibroid Embolization. What is this treatment about, and how does it work?
So I actually love explaining it as science fiction because it's such an amazing option in the fact that there's no cutting, there's no wound, there's no sort of stitches. We basically work from so particularly with the embolization. So interventional radiology is essentially image-guided procedures that are minimally invasive. So I have a passion for women's health. So we offer this procedure where we essentially work in the arteries to access the blood flow that feeds the fibroids and causes them to grow. And we block the blood flow. So the way that we do that is we use image guidance. So that basically means that we use real-time x-rays. We access the arteries either from a little pinhole in the wrist, which is the radial artery, or from the artery in the leg, in the groin. And then we essentially navigate thin little tube. It basically looks like a long drip. It's called a catheter. And we guided by a special machine, which is super clever. It basically subtracts the bones and the soft tissues. And then when we inject dye, we get a beautiful roadmap of all the arteries. And then we navigate this little tube through this little roadmap. We find the arteries that we want to target, and then we essentially inject these tiny little beads into those fibroid arteries, which are supplying the arteries and feeding them and making them grow. And by doing so, we reduce the blood flow to them. The fibroids become inactive, they stop growing, they often shrink over time, which is great. The degree of shrinkage does vary from fibroid to fibroid and patient to patient, but our main sort of outcome and the way we gauge sort of success following the procedure is to see if the symptoms have improved. And following the procedure, the improvement in bleeding is around sort of 93 to 95%, and also pain, which is amazing. So it's an amazing alternative. It's something that is definitely worth considering. It is important to see, your gynae or your fertility specialist to discuss these sort of options, have appropriate imaging to exclude that there's nothing else that we're missing. We often do, as part of our protocol, a detailed MRI scan for all of our patients so that we're not missing anything and we know, what we're dealing with. And then it's just something that patients need to be aware of, just so that they're not scared of the fact that, as any, these fibroid treatments are, extremely scary. There's, the recovery is very prolonged. There's sort of lots of bleeding and complications. There are options like the UFE where the recovery is shorter. There's a lower rate of complications. The recurrence rates in terms of the fibroids sort of growing back and becoming active again is lower, and it's just a lovely alternative if it's indicated for the patient.
So we're talking this morning to Dr. Maja Wojno, who is a interventional radiologist and using UFE. So what was the traditional approach to dealing with fibroids, just looking at how different what you do is to what was previously
So the general sort of approach would be, I'm of course not a gynecologist, but the traditional sort of options, depending on the presentation of the patient, would be either sort of medical hormonal management for the symptoms, either the bleeding or the pain, or the, for instance, the intrauterine devices, which also control some of the symptoms. And then the traditional options for years and decades would be either to surgically remove the fibroids, which is called a myomectomy, or actually remove the womb, which is a hysterectomy. So although this procedure that I offer, the UFE, has been around for a very long time, it's still gaining in popularity in South Africa, and actually even over the world, in terms of, the access to, the facilities that can offer this, because a lot of these sort of theatres and x-ray equipment are obviously quite expensive. The access to that, the access to, appropriately trained staff is still an issue. So, in first world countries, it's sometimes a little bit easier. But, research also suggests that the access, all over the world is still, suboptimal. So our aim is to sort of raise awareness about these procedures, that they are available. That is definitely something to look into. And it's something to consider. If, a lot of patients that actually come to us, they, have had numerous surgeries in the past. They really don't want other surgeries. They may be sort of terrified of surgery. So there's lots of different reasons where we can offer a less invasive option. There's also patients who are not candidates for surgery because they're very sick. And they can't have a general anesthetic. So our procedure is done under sedation, which is like a deep sleep. So it's definitely got its benefits. But I think, as we do approach this as a multidisciplinary team. So, the diagnostic radiologist, we review the imaging, the gynecologist, the fertility specialists. I think it's also important for everyone to be on board, for the patient to understand her options, and make an informed decision with guidance by all the specialists and the team. And all we can do is provide all the information, the advantages, the risks, the outcomes, and counsel patients in terms of what their options are, because I think that's really important. Because a lot of patients actually come to us to say that the only option that was given to them was a hysterectomy, and a lot of these patients are still young and wanting children. So it's not always the case, but it's just something just to think about.
All right, so Doctor, we're going to end our conversation here.
Thank
you. We're talking about uterine fibroid embolization, the UFE, which is a minimally invasive procedure, which perhaps then you could consider if you've been battling fibroids. And yes,
Puleng, can I just say one thing, if that's okay? So firstly, thank you for having me. But I also promised my patient, Simone, so I promised that I'd do a shout out for her. Is
she listening?
She is. She said she was going to listen, and she's actually recovering in ICU. She is the bravest lady I've ever met. She has been through so much in her life. She is recovering in ICU, doing much better. We're actually discharging her today, but I just wanted to send a shout out to her and just say that she's amazing and so brave. And so she's gone through this procedure recently, and she's actually going home today. So, but I just wanted to send a shout out to her. I told her that I promised her that I'd say that. So sorry to interrupt you.
No, shout out to Simone.
Yeah,
she's being discharged today.
Yes.
Oh wow, that's good news, Simone. Have a good recovery. Saturday, and thank you so much for coming. I do
thank
have
you,
to.
Puleng. Yeah. Oh, last two questions. Yes. Okay.
No, I have to go to a commercial break.
Oh, sorry. Okay.
Let's take a break.
Thank you.
Darubini ya Afrika na I am Henry Shakif.
Inaelezwa kwamba serikali kule visiwani Zanzibar